So the purpose of our work was to evaluate the effectiveness of a single intravitreal injection of ocriplasmin in eyes with diabetic macular edema and focal or loose broad vitreomacular adhesion or traction in cases where proliferative diabetic retinopathy was present, and also to compare these results with those obtained in eyes with non-proliferative diabetic retinopathy. So this was an observational single-center case series of 5 eyes with a proliferative diabetic retinopathy who received intravitreal ocriplasmin for diabetic macular edema with VMA. Our primary endpoint was VMA release rate during follow-up, and the secondary endpoints included the variation of maximum central foveal thickness and best-corrected visual acuity, the reduction of the number of intravitreal injections of anti-VEGF drugs, and VMA release rate in these patients compared to our patients with non-proliferative diabetic retinopathy submitted to the same treatment. So, of our 5 eyes, 4 had optic disc neovascularization and 1 had retinal elsewhere neovascularization, and at baseline all received treatment with intravitreal injections and laser therapy. The mean follow-up period was 13 months, and as you can see, VMA release rate was 80%, and it occurred at medium at day 34. No complete posterior vitreous detachment was seen in these eyes, and as you can see, VMA release rate was similar in patients with proliferative and non-proliferative diabetic retinopathy. As secondary endpoints, we see that in eyes with VMA release, we have an improvement of 9 letters in best-corrected visual acuity and also a decrease of 21 microns in central foveal thickness. Also, the number of intravitreal injections appeared to have a reduction, and 2 patients needed no further treatment during the considered follow-up. So, in eyes with VMA release, both in proliferative and non-proliferative diabetic retinopathy, we observed a reduction in the number of intravitreal injections and also an improvement in best-corrected visual acuity and central foveal thickness in both groups, and we observed no significant differences between the results of the 2 groups. As conclusions, we can say that in eyes with diabetic macular edema associated with VMA, ocriplasmin injection appears to have promising results. The results of our study suggest that eyes with a proliferative diabetic retinopathy may benefit from this therapeutic alternative and does not appear to be a poor prognostic factor in response to this treatment, but studies with larger samples are needed to assess these results. Thank you.
Thank you for your study. It's an interesting one, but I just wonder how long was your duration for vitreomacular adhesion release, and as far as I learned from your presentation, it's almost 80%. It's much more than expected. How do you explain it?
Yes, we think that it's due to the small sample number. We just maybe get lucky in the 5 cases. And I don't know, the first part of your question was?
How long did you wait for the vitreomacular traction to release? No, I mean, was it within first week or?
No, we see the patient until the 4th day after ocriplasmin injection, and then monthly during the first 6 months. And in median, it occurred at 34 days after ocriplasmin injection.
Within 1 month?
Yes, okay. The first month majority of cases.
But
yes.
Thank you.
Can I just ask a clarification? Any of those eyes has had a VMT or a vitreomacular traction, or they were?
Yes, 2 of them had VMT, yes.
Okay. Did you have any hemorrhages during the PVD?
One case of hemorrhage, yes.
Okay.
And also the technique of the injection is since 2016, yes,
okay.
Is different. Is a guided procedure. We inject very closely to the macular area. We had a higher percentage of success.
Okay. I mean, just for as a logical question, I mean, how do you justify, because this is a very expensive drug, and obviously this is not one of the indications in use of the drug. Was it easy to get the drug for this?
There is a focal adhesion.
Okay.
How can we say that
But
there is
DME.
not a traction? They improve.
Okay.